Hello wonderful students, myself Dr. Maddineni Srinivas, Dermatology faculty from Bharat. So in this video we are going to look at the PYQs of INICET May 2024 Dermatology questions. So all the INICET questions are very important because there is a high chance that the same topic is going to be repeated in the upcoming exams. So watch this video till the end. So first question, annular lesions are seen in all except. If you know the correct answers, put your answer in the comments below. Tinea corporis, yes, annular lesion is going to be seen. Porokeratosis, pityriasis rosea, in all of them we are going to see the annular lesion. Remember, dear students, in the urticaria, we are not going to see the annular lesion. So first you should know what is the annular lesion. It is a ring-shaped lesion which is going to have a different center and a different periphery. As you can see here, this is a breakfast in the South India which is called as a vada, which will have different center and different periphery. Likewise, annular lesion. So you can see annular has 2 A's and vada has 2 A's. So both these are going to have the same description, different center and different periphery. In the case of annular lesion, it is a ring-shaped lesion like I have already told you, and the periphery is going to be active, center is going to be inactive or clear. And the important example is Tinea corporis, which is the dermatophytic infection in which we are going to see the periphery which is active with raised margins and scaly, and the center is described as clear or clearing. Okay, so this is an annular lesion, and if you look at the urticarial wheel, what can you identify? So this is the urticarial wheel. It is going to have a central pallor and periphery is going to show the erythema. So here it is not basically a ring shaped lesion, the shape also can vary, so that is the reason why this is not categorized under the annular lesion. And coming to the option porokeratosis, porokeratosis is a disorder of the keratinization because of which we are going to see this ring shaped annular lesion which is going to have the periphery which is called as coronoid lamella. Just remember these names: porokeratosis, keratinization disorder, and a coronoid lamella, which is a hyperkeratotic border. And you might be wondering, sir, in pityriasis rosea, where we are going to see annular lesion, remember Herald patch, which is also called as a mother patch, is the annular lesion which is going to have a very characteristic scale which is described as Collarette scale. Okay, so that was question 1. So next question is a match the following type. You need to match all the diseases and the investigations done. Tinea. So whenever you have these type of match the following questions, you might feel that, sir, it is very difficult. But the good news is that if you know at least 3 or at least 2 of them, you can at least eliminate some of the options. Like for example, tinea. So what is the investigation you are going to do? Microbiology knowledge. It is KOH mount. Absolutely alright. Lepromatous leprosy. What can be done? So option A, biopsy, and also slit skin smear, both of them can be done. So we'll write both the options here, A and C. Okay, lupus vulgaris, which is the most common type of cutaneous tuberculosis in the adults. So in that, biopsy can be one of the investigations. And allergic dermatitis, allergic contact dermatitis, in which patch test is going to be investigation. So from all these options, what do you think is the correct answer for this question? So we can mark, the A, which is B, C, A and D. All these are perfectly matching. So remember, dear students, in the case of the tinea, the KOH mount is going to show you the hyphae. Hyphae can be noted, and this is a slit skin smear which we are going to take from the earlobe, and we are going to put it over the glass slide, and we are going to stain with G-Nielsen stain to identify the acid-fast bacilli. If you remember, NLEP and World Health Organization use this in one of the cardinal features to diagnose a patient as of leprosy. In the case of the PKDL, so this slit skin smear is going to identify the amastigotes in the gene sustain. Just add-on point I am trying to tell you. Next is a patch test. Yes, it is the investigation of choice for allergic contact dermatitis, where we are going to identify the type 4 hypersensitivity reaction. And the good news is the reading of the patch test is taken, the best reading is taken on the day 4. So it is going to identify the type 4 hypersensitivity reaction, that is delayed type or cell mediated immunity, and the best reading is going to be taken at the day 4, that is we can say 96 hours after application of the patch. Okay, so this is about the KOH mount. What are the additional points you need to know about the KOH mount? So P versicolor is going to show one important finding which is called as spaghetti meatball appearance, very important from exam point of view. Chromoblastomycosis, which is a deep fungal infection which is produced by the diatomaceous fungi, is going to show the copper penny bodies. Again, very important finding, KOH mode. Copper penny bodies are also called as medullary bodies, muriform bodies, or sclerotic bodies. In the case of the Candida, what we are going to see, we are going to see the pseudohyphae and budding yeast cells. So these are all the important findings in the KOH mode. So next question, so which of the following leprosy medication is going to produce hyperpigmentation of the body? And if you have marked clofazimine as the answer, you are absolutely correct. So remember, dear students, clofazimine usage is associated with this kind of coppery red pigmentation over the body of the patients. Okay, that is very big problem for the patients, but it is reversible. Once the clofazimine is stopped, it is going to become normal, but it takes time. Which form of vitiligo is initially progressive and later on becomes stable and non-progressive? This is a very important type of vitiligo which is being asked in recent years in various exams. In FMGE also it was asked. So if you have marked the answer as segmental vitiligo, you are absolutely correct. So remember, dear students, segmental vitiligo is going to start in the early childhood and it is going to be unilateral and segmental. Can you remember any viral infection which is unilateral segmental? And if you have remembered it as herpes zoster, you are absolutely correct. Yes. So this condition, segmental vitiligo, is also going to be segmental and it will not cross the midline. As you can see in this picture, this patient is having the lesion on the left side, there are no lesions on the right side. And what is the important point in the prognosis of this disease? Once a dermatome is completely depigmented, there is not going to be any more progression because it is strictly a dermatomal disease. One segment, once it is having the depigmentation, there will not be any more further lesions developing. So this is the stable type of vitiligo which you need to remember. And what is the treatment modality we are going to use? It is going to be mainly surgical intervention. We are going to take the melanocyte from other area of the skin which is having normal pigmentation, or we can take directly the skin and graft it on the site of the depigmentation. So if you can see clearly, segmental vitiligo has alphabet S, stable, it is a stable vitiligo. And what is the treatment? It is mainly surgical. So yes for Srinivas, yes for stable vitiligo, segmental vitiligo, and surgical treatment modality. And if you can look at this part, you are having another question. So you are having a patient who is looking up and you are able to see that the vitiligo is present on one side in a segmental fashion. So it is segmental vitiligo. This was asked in the INICET 2021. So the examiner is going to evolve and ask more complicated or sophisticated type of questions as the year goes on, passes. Okay, drug resistance is most seen with which STA? And if you have thought of the answer as gonorrhea, you are absolutely correct. And in fact, this is the very reason why the recent NACO guidelines, that is the kits which are used for sexually transmitted infections, in the kit 1, if you remember, which is a grey colored kit, the dosage of the cefixime has been increased from 400 mg to 800 mg, and the reason for this is because the resistance of the gonorrhea, it is developing resistance very rapidly to the medication cefixime. So that is the reason why the dose is increased in the kit number 1. Okay, this is the next question. Mother has painful vesicular lesions over the genitalia 1 year back. Now baby is born with the features of meningitis and fever and vesicular rashes over the abdomen, and also died within a week, unfortunately. So scrapings from the lesion showed multinucleated germ cells. So with all these clues, what do you think is the correct answer? If you have marked the answer as option A, HSV2, you are absolutely correct. Very good. Remember, dear students, mother was having these lesions which were vesicular 1 year back. So most likely it is herpes genitalis. So whenever you have the sexually transmitted disease, very important topic from exam point of view. So baby can develop the meningitis due to the herpes simplex virus, viral meningitis. Not only that, vesicular rashes are seen over the body, it is now also involved in the skin, and also there is death. And on the scrapings, multinucleated germ cells are seen. All these clues are pointing towards only one organism, it is HSV2. And remember, dear students, what do you think is the correct answer for this question? Patient presents with the following lesions over the genitalia. We are able to see there are grouped vesicular lesions present over the genitalia, and it is herpes genitalis. And yes, on examination, on scraping, we are going to see multinucleated germ cells and also Zang cells, that is acantholytic cells. So the correct answer for this question is going to be option C, both. So that's why whenever you are in the exam, always read all the options very carefully and then only mark the correct answer. So I hope all of you have enjoyed this video. So please do hit that like button. Also do subscribe to my YouTube channel, and we are going to meet in the next video. Till then, happy learning. Sarvam Sri Krishna Param Sarvechana Sukhna Bhavantu.